So I'm Kelly Knupp. I'm a pediatric neurologist who specializes in epilepsy. I work at Children's Hospital Colorado, and I'm a professor of pediatrics and neurology at the University of Colorado. I take care of children with drug-resistant epilepsy as a large part of my practice. My research has been mostly health outcomes research, but also clinical trials in children with developmental and epileptic encephalopathies. My primary area of focus is Dravet syndrome. So that's where I do a lot of my work. I've also done a lot of work with infantile spasms as well. Dravet syndrome is a rare monogenic epilepsy syndrome. So it's caused in the vast majority of children by a pathogenic variant in a single mutation in the SCN1A gene, which codes for a sodium channel. These children usually present in the first year of life with prolonged febrile seizures. Sometimes they can be a little bit unusual in that they'll have seizures on just one side of the body. They're called hemiclonic seizures. And then moving into the second year of life, we start to see other seizure types emerge. They tend to be very refractory to medications and treatments. We also see that they're very temperature sensitive. So it's not just happening with fever, but can happen on a hot, sunny day, getting in and out of the bathtub. Things that will abruptly change temperature tend to provoke those seizures. Many of the children have seizures throughout their lifetime. Those seizures do change as they get older, where we start to see clusters of generalized tonic-clonic seizures, which may occur predominantly at night during sleep. We also see changes in development with plateauing of development, often in the school age years. We see a progressive ataxia. The children also have a number of behavioral disorders that tend to be associated with this. They tend to be really, really busy, active kids in their preschool years. They slow down in their activity as they get older. They have a lot of struggles with obsessive compulsive disorders. And they also have some insensitivity to pain, which increases their risk for injury in other settings as well. So kind of a unique group of kids. So currently these kids are managed with anti-seizure medications. We know that there are some seizure medications that actually make their seizures worse. So sodium channel blockers typically will worsen their seizures. Unfortunately, a trial of a sodium channel blocker may actually lead to their diagnosis, although we're getting better and better about doing early genetic diagnosis so that we can avoid medications that may make things worse. There is some data out there suggesting that a delay in diagnosis and use of medications that are contraindicated may actually worsen developmental outcomes. So it's really important that we get early genetic testing so that we can use appropriate medications. Fenfluramine has been a great medication for the Dravet population, where we've seen significant reductions of seizures in the trials. And there was even a small group of patients in the Fenfluramine trial that were seizure-free or nearly seizure-free, which is really exciting because that's not something that is often seen. This recent publication was actually a scoping review to look at response on generalized tonic-clonic seizures. And part of the reason that instigated this study is that in the Lennox-Gastaut study for Fenfluramine, it was noted that generalized tonic-clonic seizures seem to respond better than some other seizure types to this medication. And so this was a scoping review to see, what was there more in the literature to suggest that there was a median reduction of 47 to 100% of seizures, of generalized tonic-clonic seizures across the studies. I think something that was really notable in looking at this combined data is that when you looked at patients who had 100% reduction of their generalized tonic-clonic seizures, 29% of patients who were reported in the literature had 100% reduction of their generalized tonic-clonic seizures. And that's kind of exciting. Generalized tonic-clonic seizures tend to be big seizures. They increase risk of injury. We know they're associated with an increased risk of SUDEP. They can impact life. Quality of life. And so having a reduction of the seizure type for some of our patients can be pretty significant. Well, I think we saw in looking at this across all of these manuscripts that not just Dravet syndrome or LGS, but other developmental epileptic encephalopathies appeared to have a good response to fenfluramine when people had generalized tonic-clonic seizures. And so I think if you have a patient with generalized tonic-clonic seizures, this is a medication that you may think about trying. I think it's always important to remember that this is looking at groups of people and an individual response may vary. So, not everybody responded, but a significant percentage of patients responded. And so I think this is something that needs to be considered as a treatment, particularly when generalized tonic-clonic seizures are the main seizure type. I mentioned a little bit about SUDEP, which is a big problem for this patient population. Quality of life and injuries are something that we always want to watch out for in this patient population.